Morning all. Today we'll discuss about the CIN1, CIN2, CIN3. What are the risk of progressions? What are the risk of persistence? And the disease regressions and inversions. Okay, I'll discuss each by each. Okay, you can know CIN1 is mild dysplasia, CIN2 is moderate dysplasia, CIN3 is severe dysplasia, and invasive is squamous cell carcinoma. Okay, we'll discuss today what is the percentage of natural history of the CIN lesions. Okay, we'll discuss natural history of CIN lesion. That means the regressions, the disease regression, the disease persistent, and it is progressions, and it is invasion to squamous cell carcinoma. Okay, what is the percentage? First, we'll see today is the natural history of CIN lesion, like cervical cancer lesions. First is CIN1. Okay, the regressions we have at forefront, the regressions, then persistence, and progression to CIN3. Last is invasions, that is invasive carcinoma. Okay, so first is CIN1. CIN CIN1. What is CIN1? What is the percent of regressions? We'll discuss CIN1, CIN2, CIN3. Okay. First, we'll discuss the regressions. What is this? If many patients are coming to your OPD with report of CIN1, 2, 3, and they are asking you, sir, what is the progression of a disease to CIN3 and to invasive cancers? If you know this data, this percentage, then you can counsel the patients. It is very easy to remember. I will discuss regressions. The mnemonic is you have to do 50, 40, 30. Okay, the regression of CIN1, 2, 3. That is almost 50%. Okay, 57%. You will remember a gross like 50%. This CIN2 regression rate is 43%. And CIN3 regression rate is 32%. So if you remember at a actual value, like if it is 2 want to remember, then you can remember as 50, 40, 30, 1, 2, 3. Okay, 50, 40, the regression rate. Okay, then the each CIN1, 2, 3, the persistence of each lesions. If it is 1, then it is 30, 30, 50. Okay, almost it is 32%. The one persistence 32%, CIN2 persistence is 35%, and CIN3 is 56%. So the easy to remember, if the patient will ask for what is the regression, whether it is regression back to normal, say 1, 2, 3, it is 1, it is 50%, is 2 is 40%, is 3 is 30%. If what is the persistent, over the risk of the persistent lesion, 1 ka 30% is 2 also almost 35%, 3 is 50%. Yeah, almost you can remember. What is the main important thing is these two, they will ask in repeatedly these two questions. What is the progression of CIN3 to CIN3 and invasive carcinoma? Each CIN1, 2. Okay, what is the progressions? Okay, here also mnemonic is the CIN1 progress to CIN3 is 11%. So very low chances to it is progress to CIN3, and the CIN2 progress to, it is just double of 11, that is 2 times. Okay, 11 into 2 is 22%. CIN2 is converted into CIN3. Then the invasive risk cancer, invasion cancer for CIN1 is progressed just 1%, very important. And for CIN2 to progress to invasive carcinoma is 5%. Okay, for CIN3 to progress to invasions is more than 12%. Okay, so very important this table. If you remember, then every questions you can answer about CIN2, and regarding any question they can ask regarding progressions, persistent regressions, and invasive lesions. Okay, is the natural history of CIN 1, 2, 3. Okay. So very very important. If they are asked regressions of CIN 1, 2, 3, if the regression, that is the mnemonic is 50, 40, 30. 50, 40, 30, that is 57%, 40%, 30%, 1, 2, 3. If it is they will ask persistence, almost 32% 1, 35% 2, 56% 3. Okay. Then progression to CIN3, 1 is progress to CIN is 11%. If you multiply 2, it is 22%. CIN2 progression to CIN3. And the invasion 1 is the invasive risk of invasive carcinoma is 1%. For 2, invasion risk is 5%. And 3 is 12%. Okay. So you can see this is the CN1, 2, 3 mild, moderate, severe dysplasia and squamous cell carcinoma. Thank you. Please subscribe my channel if you like this content. All the best.